All right, we want to thank people for coming today. We know we've still got a couple people are looking for seats. We've got them sprinkled out here, so please don't feel like you can't go and wander amongst us to find a seat. We want people to be comfortable. My name is Meredith. I'm with the Anti-War Committee. I want to welcome you today. If you've never been to New City Center, I've had several people already ask me where the bathrooms are. So if you go out this door and you take a left, there are multiple bathrooms. There are two sort of, non-gendered single stall ones, and then there's two sort of larger ones that have got multiple stalls that are gendered. But like that's the direction you can go for the bathrooms. We also have some snacks in the, entryway if people would like coffee or donuts or things like that. We would really like to ask people to put their phones on mute or to put their phones on silent, just because this is going to be a very emotional and very thoughtful talk, and would be really good if people could have an experience that would allow them to really be able to focus. Okay? We have masks by the back door. If people are interested in wearing a mask, you are invited to do so. And I really want to just sort of take a sense to sort of ground us in why the Anti-War Committee wanted to have this event. And then I'm going to turn it over to Nick, who is one of our MCs for tonight, who's going to orientate you and then introduce Willy Massay, who's our guest speaker, of course. And then Liz, who's up here with me, is going to help facilitate the Q&A at the end. So we're not going to do questions during the talk, but if, for example, you have questions during the talk, you're free to write them down or to hold on to them in some way. But we want to, have sort of a stack at the end. I also think it's important to understand that, of course, and maybe I don't have to say this, but I just think it's important for people to be mentally in the right place. The things that Willy saw in Gaza are fairly disturbing. Okay? People are actively being murdered in Palestine, and the destruction of the healthcare system is just another form of murder that is happening in Palestine. And so Willy has given this talk before, and he's going to talk us through different slides, sort of trying to prepare people for what they're going to see. But what I do want people to feel like is that at any time, and Willy's going to sort of talk people through different slides, but at any time that you feel like you need to leave, I want people to feel like there's that space. Like everybody's going to be able to process this reality in their own way, and some people are going to need to do that by taking a breath. We've got people who are going to sit with people in the entryway if you need to sort of have someone to sit with. We also want to, some people will choose to just look at the ground and not look at the slide, but they still want to hear what Willy has to say. There's lots of different options for what people could do when you feel sort of overly confronted by the effects of genocide and the effects of what our taxpayers' dollars are paying for, which is super double horrific. But we want to create a space for people to sort of choose what helps them be able to get the most out of the event that they can handle. And I think it's important to not have sort of a space where people feel like, oh, I have to stick it out here to look at this horribly graphic thing, because otherwise people are going to think that I support this. No, we don't. You wouldn't be in this room if you didn't question U.S. foreign policy with Palestine, right? You wouldn't be in this room if you didn't want to change. You wouldn't be in this room if you didn't want your taxpayer dollars to be spent taking care of people instead of killing people. And so no one in this room should be thinking anything about anybody else's choices. I just want to express that there are lots of different ways that people can get the space that they need to be able to do what they need to do so they can get the information that Willy has brought us here, which is so hard to get out of Palestine. Right now, if you really want to know what's going on in Palestine, it is very difficult to hear it. You're not going to hear it from the Star Tribune. You're not going to hear it from Minnesota Public Radio. You're not going to hear it from any of the mainstream media, because they're only basically reporting to what the Department of Defense sends us as press releases, or what Israel sends us as press releases. And so we have got a real opportunity to hear from someone on the ground in Palestine, and I think that that's an opportunity for us. We are a year into this genocide. Many of us have been protesting literally multiple times per week for over a year now. Many of us have been protesting for longer than a year for justice in Palestine. And so I think it's important that as you're here today to figure out what you can take from this talk that you can do to fill your resolves, sort of to give you that strength to be able to keep fighting for longer. Because the fact is that we have a longer road to face, right? We have not won what we need to win yet. And so Willy's got some very powerful stories, and those are stories that we could use to talk to our coworkers, to talk to our family members, to struggle against people when people say things like, I don't know why those students aren't studying. Like, why are they taking over Morrill Hall? Well, they're taking over Morrill Hall because there's a genocide going on, and some people refuse to look away. And so Willy has got those types of stories that we can use to grow our movement, and that is what we need to do. We need to be growing our movement, and we need to be investing in this movement, and we're hoping that this talk today can help inspire people with that. Our very own Sabri Wazwaz, who you all know and love, went to Omaha several weeks ago and got to hear Willy firsthand, and Sabri was like, oh my God, guys, you have to hear him. He's amazing. And so we're very excited that we are going to get to have our own experience, because Sabri's never lied to me, okay? So the fact is that we're really blessed here in Minnesota that we're going to get to hear from Willy firsthand. I know that Willy feels, we talked earlier today, that he feels compelled to have to talk about what he saw in Gaza, because what he saw was just so horrible. And I know that this is important to understand, that like when you see the things that Willy has seen, you feel like you have a compulsion, you feel like you have a calling, you feel like you have a need to change the reality that you saw. So we're really hoping today in the Anti-War Committee, not just that you learn about what's going on in Gaza, but that you can join with Willy and the Anti-War Committee in changing the reality that he is reporting about today. So I'm going to turn it over to Nick Tolliver. Nick is a member of the Anti-War Committee who is going to be introducing the event and then specifically introducing Willy. Thank you very much for coming. And if you just got here, we do have some seats right up here in the front, over here in the right in the corner. So as people are coming in, if you see someone come in, please help direct them to a chair, because we want people to be comfortable. Thank you.
Hello, welcome. Thank you all so much for coming out. My name is Nicholas Tolliver, and I am a member of the Anti-War Committee. In my life outside of anti-war activism, I am a healthcare worker. More specifically, I'm a psychotherapist and a clinical social worker. I am here today to introduce you to our brother, Willy Massay, a critical care ICU nurse who is with the group Nebraskans for Palestine, who will speak to you about the health crisis in Gaza, and will speak to you about the violent conditions of the illegal occupation, apartheid, and genocide which has produced this health crisis in Gaza and which has led to the deaths of hundreds of thousands of people. The mainstream media and Zionism's many apologists seek to portray what is happening in Gaza as a humanitarian crisis, as if a bad hurricane or an earthquake has hit Gaza. They act as if no one is responsible for the extremely high casualty rate amongst civilians. Their headlines will say things like, a bomb has hit a refugee camp, or a school, or a hospital, as if bombs simply fall from the sky in Gaza. There is no mention of who is dropping these bombs, Israel, or who is making and supplying these bombs, us here in the US. They will speak about famine and cholera outbreaks and shortages of every good necessary to the sustaining of human life, and not mention the illegal Israeli blockade which is keeping these items out of Gaza. The mainstream media and Zionist Hasbarists are trying to manufacture consent for Israelis' genocide in Palestine. Our elected officials are seeking to hide their complicity in Israel's crimes against humanity and seeking to obscure their ability to end this senseless violence immediately if they so chose. Finally, Zionists and the mainstream media want to paint the resistance to this illegal Israeli occupation as terrorism, when they are the ones using collective punishment and genocide as weapons of war. They want us to believe that there are terrorists within every school, hospital, refugee camp, and aid organization that they bomb. It was Malcolm X who said that if you are not careful, the newspapers will have you hating the people who are being oppressed and loving the people who are doing the oppression. This is why CNN writes heartfelt profiles about Israeli soldiers getting PTSD and committing suicide from the war, with only a passing mention that the soldier who got PTSD got it from crushing civilians with an armored bulldozer. Meanwhile, the term PTSD does not even accurately capture the Palestinian experience in Gaza, because there is no end to the traumas that they are enduring. There is no post to their traumatic stress. The clinical language does not even yet exist to describe what the Gazans are going through. Those in power want us to be good little liberals and to condemn the violence of the oppressed while remaining silent about the violence of the oppressors. We will not do it. We will not condemn the resistance. We assert their right to resist genocide by any means necessary and available to them. We stand in solidarity with the people of Gaza and in opposition to the imperialist and the Zionist supremacists who seek to make us complicit in their crimes. This is why it is so important for us to hear from Willy Massay. He is one of the few people here in the States who has seen what is happening in Gaza firsthand and is here to raise awareness about the genocidal conditions in Gaza. Everyone please give a big round of applause for Willy Massay.
I'm not sure where to begin because I'm definitely not a good speaker, but at the same time, I gave my promise to the Palestinian children in Gaza that as long as I breathe, I will speak for Palestine, I will speak for them. And I also promised them that there's a lot of people in the US that supporting them. And a lot of them realize that. They say, hey, we know your government hates us, but we do also seen American people on the streets that are protesting for us. So you are the voice. You are the voice of the voiceless. And I appreciate you guys for coming here. But first and foremost, I want to thank my brother, Habibi. I met Sabri 2 days after I landed in the US from Gaza, and I was wearing my kofia. We were a little joined with a few friends that we went there for the smoke hookah, so I just went there to kind of wind down. And then I'm wearing my kofia, and he looks, he says, oh, I didn't think I should be wearing my kofia in Omaha, Nebraska. I didn't think people would like me here. And then he was very happy to, I said, brother, yeah, you should have worn your kofia. And we became friends. He said, I have to have you come to Minneapolis. And so that's why I'm here. Thank you, brother. A very hospitable gentleman. If you want to see a spirit of Palestine in one human being, is right there. It reminds me of a good friend of mine. We'll talk to him about it later a little bit. Dr. Muhammad Zahir, good brother of mine, loved him to death. I worked with him in the ICU there. Unfortunately, we'll talk about him in a little bit. But his wife, for 9 months, they didn't have no eggs. For whatever reason, the UN brought eggs. They gave 6 eggs for each healthcare provider. The next morning, Dr. Muhammad brings shakshuka. Yeah. I told him, brother, your family needs to eat eggs, but you haven't eaten for 9 months. He's like, no, my wife wants you to eat. That's him, right there. Thank you. Meredith, thank you for planning this and organizing. We've been in contact communication. Nick, thank you so much. My sister here, I appreciate you. And the whole Minneapolis group, you have been so kind to us. I'm here with one of our Nebraskans for Palestine. Member, Caitlin is in the back. Thank you for coming here. A couple of other things that, housekeeping things. I work in healthcare. I worked in a trauma unit, and I've seen a lot of blood. But this was too much for me too. So at any moment you feel like this is too queasy for you, this is too much for you, you can close your eyes, look down, or walk outside. I totally understand that. And this is the reason we're sharing this is not because we want you to show just the suffering of the Palestinian children, but it's the same thing that we shared, some of us shared with South African lawyers who are working with ICC, ICJ, to show crimes against humanity. Remember, there is no journalist, international journalist who can go in. So South Africa somehow has to depend on healthcare workers. So you go to Gaza, you become everything: a journalist, a nurse, a doctor, a father, a brother, mental health care. You said something about there's no P in their stress disorder. It's true. It's very true. So anyhow, so without further ado, thanks for having me, and we'll bring the PowerPoint. And I'll be talking through some of this stuff. So here, so I want to talk a little bit about, first and foremost, is the process of applying to go to Gaza is very difficult. Since October 23rd of 2023, I applied to multiple organizations. And of course, I didn't hear from anybody because nobody was taking anyone because Israeli had stopped anyone from going. I didn't hear anything. And then finally, around January, somewhere there, they said, well, we want to take you in February. And then they canceled that. Every month, you will go for a month, for 2 weeks, they canceled it. So Israeli was making it really difficult for anyone to go. Finally, in June, they came to me and said, okay, we want to take you. Are you ready? I said, I'm ready anytime. So we were able to go in July. So the process of getting in, once you get into Amman, because Rafah border is closed, right? In Jordan, so you go through King Hussein Bridge crossing into the West Bank. While you're there, I want to tell you how difficult it is. And in Israel is really good at making you very angry. First of all, we were only allowed to bring about 3 to 4 kilograms of food personal for an entire time there. But to make matters worse, really, really horrible, is that once you get there at King Hussein Bridge, they're going to look at everything you brought in. They opened my tuna cans. They thought I'd brought some bombs or something. I'm like, brother, dude, how can you open 8 tuna cans? There is no bombs, but yet keep opening them. First of all, they will never have crossed in the U.S. through the airport. And he's like, well, I don't know what else is in other cans. I'm like, there's 8 of them you open, and I want to eat. And of course, they know that once they open a tuna can and put his finger in there to go around it, I'm not going to eat it anymore, you know. So just do that so that they get you angry, you lose your cool, and then they send you back. That's all they want to do. And then you're only allowed to bring in $3,000. That's it. No more than that. No money goes to Gaza. Nothing. No medical supplies. I brought 2 bottles of Tylenol and ibuprofen. They only allowed me to take half, and the other 2, they dumped him, they took it away. Provider, a doctor friend of mine who brought, this ultrasound. I brought one, he brought one. His was taken away for whatever reason, mine was not taken away. They threw away this ultrasound machine. Whenever you have, we use it for fast exam in the ER to see the types of injuries and all that. They took it away. They say, you don't need it. It's not necessary for you to take it to Gaza. And he says, but I'm going to use it to work. No, you don't need it. So they took it away. A brother brought in about 3,500. He was not able to go into Gaza. They returned him to Amman. They said, you had more money than we told you to bring. So a lot of restrictions because they don't want you to take anything into Gaza that you can leave there and give it to people, even Tylenol. That's how ethnic cleansing works. Torture, kill, deny people in Gaza healthcare, even pain medication. So, and then you get into the King Hussein, and then you go to Karim Abu Salem, and then into Gaza. Now, once you cross, so here, once you cross Karim Abu Salem, then you get into Gaza, and this is Nasser Hospital. Now, I just want to say the picture on the left, that's Nasser Hospital, but what the building you see, that is the dialysis center in Gaza, the only dialysis center there. But the dialysis center, Israel, when they invaded Nasser Hospital, they killed healthcare workers. Most of them were zip-tied and buried alive. Some of them still have their scrubs. Patients still were tied. They still had their IVs hanging on them. So that's where there was the mass graves. But before they left, they burned down the dialysis center. You can see the smoke through the windows. All the 22 dialysis machines were destroyed, burned by Israeli forces. So now imagine this, not only Palestinian people in Gaza are being bombed and killed by the bombs we paid for, but people with chronic illnesses like kidney disease. Nobody's getting dialysis in Gaza. Heart disease, diabetes, nobody has insulin. People are dying of other diseases besides being bombed. Look at how systematic the killing machine, the Israeli killing machine is. So right now, I've met patients in the ER who came to us with chronic kidney disease, end-stage kidney disease. Patients look yellow. Yellow. They cannot pee, they cannot do anything. All the other vitals are horrible. It's a matter of time they die. Next. So these are my four brothers. The gentleman in the left, he is a retired general surgeon. Dr. Safwan, he's Lebanese French, good guy. The tall gentleman in the middle, Dr. Ayaz, he's out of North Carolina. And of course me, I was the only nurse there, and then surgeon, Dr. Ayaz is an ER doctor, and then the gentleman on the far right, on my right, the other side, is Dr. Shadman. He is a vascular surgeon. We are the only four people who went to the north of Gaza since January, since Rafah crossing. They won't allow anybody to go to north. Nobody. And that gentleman in the middle, as Dr. Khan, he is an anesthesiologist out of Chicago. However, he wasn't able to go to north because for whatever reason, Israel will decide who goes north, who doesn't. So they denied him to go north. He's an anesthesiologist. We need anesthesia very bad. But yes, of course, yes. So then because we didn't have anesthesia anyway, but the little anesthesia medicine we had, they won't even allow the gentleman who will use it. We were crossing this, him and I there were crossing the Karim Abu Salem. I was the only black man, of course. They were very racist to me because they have all these AI guns and cameras looking at you, these automatic gates as you walk in, you're walking, and they told me to stop. I will stop through the cameras, and then they start laughing. They were saying some really derogatory, racist things through the cameras. Say, oh, there goes the Palestinian slave. He never learned from his ancestors. I'm like, oh, I guess. But anyway, they use a lot of words like the N-word, all that, the N-word of Palestine, and they are giggling. At some point, I said, every 5 steps I took, they will tell me to stop. I will stop because all their guns are looking at me, all the cameras are looking at me, and I'm pushing 2 big bags, and in my backpack, it's 105 degrees. I mean, I'm sweating, I have and first of all, I didn't drink any water, no nothing. They tell you that you cannot stop. From Jordan to Gaza, no stopping. You stop, we will bomb you. You stop, we'll bomb you. If you work in healthcare, we are the most protected group and journalists. You cannot bomb us. But with Israel, no. You're going to be bombed. You're going to be killed. They told us, if you stop, you will be killed. The soldier told us, I am the last Israeli soldier you're going to talk to. If you stop, you'll be dead. He says the other soldiers on the ground, they won't ask you questions. They will just bomb you. And that's true. The bottom picture is when the four of us arrived in Indonesian hospital, which is in the north, in Jabalia. Jabalia has been under siege for the last 22 days. I haven't heard from my friends doctors and nurses there. We'll talk a lot more about them later. Next. This is dialysis center I talked about in Nasser Hospital. Next. So this is Indonesian hospital. This is before the current siege. The last 22 days, Indonesian hospital has closed because Israeli forces went back. They took doctors, nurses, patients, they would drag them out. Doctors were arrested. One of the doctors, he's a good friend of mine, I told you about, he reminds me of my brother here, completely destroyed. They burned down not only the Indonesian hospital that was already burned down, because there was only ICU that was working, it was opened a month before we arrived there, as well as the ER and the trauma bay. The operating room used to have 28 beds. It only had 8 because they couldn't open everything. But now even what they had is burned. They went back. And there's a school right in front of Indonesian hospital. I have pictures of it. Before, I got pretty famous there because I was able to sneak in the chocolate to the kids. So every kid knew me there. And they burned down that school too, about a week ago. So, next. A lot of blackouts in Gaza. So you are in the ER, all of a sudden electricity is gone. There is no fuel in generators. So once that is gone, the difficulty is that once the electricity goes out, any patient in a ventilator, we have to keep them alive. We have to bag them. So nurses and the doctors, we line up. You bag this patient for 2 minutes, another person comes back. The other one for 2 minutes, keep them alive until electricity comes. Otherwise, if you don't bag them, of course, you know what's gonna happen. So a lot of blackouts. Next, please play it.
No electricity at Nasser Hospital. No electricity. We're in Khan Yunis. There is no electricity. This is the trauma bay. This is where all the MCIs happen, and there is no electricity. Staff is sitting here with no lights. We just have a backup generator for some things, as you can see, the telemonitor. But everyone is functioning without electricity.
That's my friend, a good friend of mine, Dr. Mimi Sayed from Seattle. She, amazing human being. She has been receiving death threats because some of the images we shared with New York Times have been, there's a lot of Zionists out there that somebody even printed my own home address online, say, we're gonna get this guy. But they're here even in the US. Mimi Sayed also posted the school where her children go, where her husband works, where she works. And what we ended up finding out, this gentleman that was trying to get into her house recently, he's American, but he's a former Israeli occupation forces soldier. Yeah. And he knows where she lives. Next, please.
No electricity at Nasser Hospital. No.
This is what happened when Biden said be more precise. That's precise.
هذا الشيخ رضوان يا دكتور. الشيخ رضوان.
That is all of Gaza. When Biden, that was me talking there, when Biden says to Israel, be more precise, while giving 2,000-pound bombs in the most populated area on earth, how can you be more precise? What is precise? Israel, of course, does not know what precise is. And that is whole of Gaza. Nothing is left. I've been to Gaza before. It was already horrific before, but now there's nothing left. The earth is turned inside out. And if you look at that picture, at the video over there, there's areas where it's all sewer, raw sewer, because Israel not only destroyed buildings and everything in it, but even the sewage system of Gaza. So when we amputate patients and go back to their tents, they're living in a very, very difficult environment. They get sepsis, infections. I saw wounds falling, maggots falling off patients' wounds. Incredibly, not because they cannot clean them, but even the water they use to clean them is contaminated, right? Because Israel destroyed everything. And we're doing wound dressing one time, and I started cleaning the wound. It was below the knee amputation. Then I noticed that I keep on touching the leg up here, and it was hollow. I squeezed a little bit, maggots were just falling off the patient's leg. Of course, the patient was sepsis. And once you have sepsis in Gaza, even here it's very difficult sometimes. People die of sepsis very quickly. But in Gaza, it's a death sentence. That's basically for non-medical people. That's like where your blood, your whole system is, the toxins of the infection gets into your bloodstream. In Gaza, there's no antibiotics. It's death. It's absolute death. So not only do they, when patient, we send them home, you don't even know. I felt guilty. I felt guilty of this. I said, what are we doing here? What is my job? Because whatever we're doing, some of these patients will go home. We stabilize them, but they're gonna die. What am I doing here? I feel like I was guilty of being there because I'm not sure if what we were doing was actually meaningful. But that's history to judge. But I feel guilty. Next. My first encounter with Israeli occupation forces. That gentleman, I have two pictures, but that one I included there. That soldier. The first picture I took was not supposed to take a picture because we were about to cross the Israeli active military zone. So he was literally zooming in at us. I'm thinking, it's just three doctors and one nurse. What are we gonna do? We don't have no guns. Why are you zooming in your scope? Yeah, and the other two were pointing guns at us too. So at some point, I didn't tell this, but they told us to throw our passports on the ground, and then we'll go grab them. As I grab them, he said something after he put them down. I thought he said pick them up. I heard passport. He spoke Italian and broken English, and I went to grab it. I thought he said grab it, but I went there and he's like, no, I didn't tell you to grab it. The gun barrel was still warm. I was thinking, he put it in my head, I'm thinking, it's still hot. You've just been killing people. These are the people you've been using it all day. And now it's on my forehead? I was like, okay. But yeah, that was my first encounter. That's where, on the right, that's where they were being racist to me. That's fine. I don't care. They're killing people, and what's racism? They're already racist. Next. This is where the 450 or 500 patients and healthcare workers at Nasser Hospital, where the ambulances are. That's where the mass graves were after Israeli forces left. Now, if you look at the ambulances, is that that's not an accident. It's not just a bombing. They crushed them. So not only are they killing patients, but those who, once they bomb, you cannot go pick patients. I've seen so many patients being brought in who are bleeding to death on donkey carts because they have destroyed all the ambulances. That was my food because Israeli soldiers took most of my food and inspected it for bombs. So I was left with a few of them. So I calculated for 6 weeks, I can only eat 1 meal. So that was my dinner right there. I lost about 21 pounds. Dr. Shadman about, I think, 36. And a doctor friend of mine, Dr. Mossab in Gaza, he lost 68 pounds. Yeah. Please. This is our crossing to the North Gaza. It's extremely difficult because they will tell you there's 2 green lights. Green light number 1, today you're going to the north. Green light, you can drive up to Nusrat camp, north of Nusrat camp, before you go to the north. And then when you get there, you wait another more hours for them to stop bombing. So the most difficult for me situation was this. When they say you're going to, when we are waiting there for hours, you can hear bombs. And I'm thinking, I'm trained to go and help. We have the skills, but we cannot leave knowing the fact that right now somebody is being murdered, somebody is being slaughtered, and we are sitting here. Healthcare workers cannot leave. And it was very difficult. But another thing I want to share with that video is this, that before they allowed us for them to stop the bombing so we can cross, you can smell gunpowder and everything. There's only one truck that I saw for 12 hours there that went from south to north that had food and water. That's it. Next. So this is an evacuation order. While we were at Indonesian hospital in the north, they told us this. One morning at 4 in the morning, they told us we have to evacuate the hospital. If you look, it's very confusing. Where are we going? Even Gazans themselves say, it's just numbers. I don't even know if my house is within that block. Gaza is not like, is not built like in blocks. Houses are all over the place. So you cannot know where your house is. And just they told us to go that way. And we asked the Americans, we were like, oh my God, we're gonna be killed. We know, everybody's gonna like worry, like, we'll be fine. And then the Gazans like, oh, this is the thing that I want to tell you about that. I asked a doctor in the ER, I said, so you said we're not leaving, even after the evacuation order. When do we leave? He said, oh, well, I said, I asked him when you hear they're dropping leaflets, like, oh, no, that's not then. It's too early. I'm like, what do you mean? He's like, he said, when you see tanks 10 feet from you, that's when you're like, okay, it's getting serious. We have conditioned people that Israeli dropping leaflets to leave is not enough. Only when you hear and you see tanks 10 feet from you, that's when you know they're going to blow up all your houses, everything. And you can, and another thing that I want you to tell you is this. When you see, you cannot go into a destroyed home. There's bananas, those little drones are all over. They see a Palestinian, a Gazan going back to a destroyed home or going to pray into a mosque that was destroyed or to a church, they are going to destroy it again. You cannot go back to a home or a mosque or a church or a school that was previously destroyed. They're going to bomb you again. So people stay away from destroyed homes, but they're going to come again to destroy them. So we stayed. We didn't evacuate. But that night, we paid the price. They bombed everything around the hospital. One strike I remember that happened that afternoon was 62 patients that came to the ER in one strike. Majority of them died. The ER was a murder scene. You could not work without getting drenched in blood. Even our underwears were drenched in, because you hear a strike, you run outside, the ambulances, the donkey carts coming in, you grab whoever you see, and everybody's bleeding. Of course, I have zip tied my clothing, my scraps from Gaza, so that someday, hopefully, history will remember that we cannot allow healthcare workers to be drenched in blood, and see that's okay. That's not okay. Next. Graphic videos here coming up and images. Please, I'm warning you. So just so you know, 80% of patients with chronic illnesses died. 185 under the age of 5 that we saw in the ER. Keep in mind, at this point, there's limited access to the following things like water. There's no water. We had to bring our own soap to wash our hands. There's no soap in Gaza. Pain medication. Remember I told you that even my Tylenol got taken away by Israeli forces. No antibiotics, no gloves, nothing. No gauze. Remember, I read this somewhere. Gaza is the place that created gauze. Gauze from the Palestinian women stitching the trees. But they don't have even the thing they created to stop the bleed of their children. And of course, antibiotics. Hygiene, nothing. No antibiotics. Patients die. Next. Here, many times, this little guy, he was 8 years old. He was in the ICU with me a lot. Electricity went out for about half an hour. I stayed with him for all that time, bagging him, giving him some air, bagging him. I was afraid that, and then, there was bombs you can hear, and I thought, somebody else has to help me. I'm exhausted, and somebody comes and help you. Somebody comes and help you. I was afraid that he's gonna lose oxygen for long, and then he's gonna be brain dead. Because I wasn't even sure that his brain was working at this point.
Would you explain to the non-medical people here that don't understand that term bagging means? How did I see or I understand?
Oh.
But may not understand what that means.
So bagging is that when patient is intubated, there are breathing tubes in them, right? So the machine, the ventilator breathes for the patient. But if there's no electricity, there is no oxygen coming from the ventilator. So we unhook the patient, we either in a trach, the hole in their neck, or through their mouth. We give them this bag. It's like an oxygen bag. You keep on pushing it. They get air. You keep them alive with that. However many breaths per minute you're gonna give them. That's how you're gonna keep them alive for as long as it takes. So this little buddy of mine, I was afraid that he might not make it because I don't know how long the oxygen was gonna be out, because there was only about 4 nurses at that time with 12 patients. I mean, 7 minutes maximum, you lose oxygen in your brain, you'll be brain dead. And so it was a very difficult day. And also, another thing I want to tell you is this is Indonesian hospital. There's very limited oxygen because Israel, before they left, they had bombed the central oxygen system of the hospital. So next to the patient's bed, we have these tiny little oxygen tanks. Sometimes you see if people have like lung disease, you see them at the grocery store, they have walking with those little oxygen tanks. That's what we had for most patients. Next. He was 7 years old. My left hand is holding his brain matter because he got shot by an Israeli sniper. I'm holding his brain, pushing it back in. A brother there, he is bagging him. You see he's pushing the bag. The ICU and ER at Indonesian hospital, only ICU has two bags to bag the patient. I was able to sneak a couple of them, and then Dr. Ayaz brought some of them. The ER didn't have much, the ICU didn't have much either. So this brother over here, he's starting an IV. Remember, it was a very difficult IV to start because the patients are extremely dehydrated. There is no food, no water out where they're coming from anyway. So to start an IV was very difficult. Usually it's not that hard for a child. But this little guy here died in my arms. Tried to save his life. We didn't have gauze. I'm screaming, bring me a gauze, and there was no gauze. I was screaming to Dr. Mimi and say, hey, at least can you suture him? Can you grab sutures? There was no sutures. You're left with, what am I supposed to do? How can I work? Next, please. This is one of the images I shared with International Criminal Court, is that on the farthest, my left, is a gunshot wound to the back. That's the entry point. The exit point is the neck here, right here on his right. While we're doing the head-to-toe assessment, I look at him like, he's breathing from his neck. So we didn't have sutures. How can you stop? And the only one X-ray, they looked at his lungs, sent him out really quick. His entire left lung was shot by an Israeli sniper, and it was gone. So I'm not sure how he survived. We stabilized him, sent him to the ICU, but I'm not sure what happened to him after that. This is a war crime because he is just walking away after they were told to evacuate, but he still got shot, holding his grandson. Next, please. She was one. She got shot on her right shoulder. I can't really see it, but there's a wound on the back here. But she was one. That's the chaos in the ER. Every time Israel struck a building, a residential home, that a school for displaced people, that's what happened. Total chaos. And that child did not make it because the wound had gone, the bullet had gone from her right back here, and then kind of like went, the baby's neck is very small, so it went kind of in the back here, completely severed her spine back here. Of course, there's nothing you can do with that one. So, next. This is the father. Look at his legs. That's his daughter. She was 7. Mom. Son. He was 10. The little one on the table, the last picture at the end of the video is, it was 6 years old. His entire head was open. There was really nothing we could do because this is one thing the Israeli army does. Whenever they shoot a child, a person in Gaza, it's usually a killer shot, either to the neck, to the head, and to the chest, or femoral artery, like right here. When you get that, patient will die because they're going to bleed to death. If you hit this artery here, it's gone. So a lot of shots, that's a lot of patients we saw. That's kind of the wounds that we treated. The ones that we treated. And that this entire family was critically injured. Another thing I want to tell you about that patient, this family, is this. They were displaced. When we're trying to help the daughter, the father never lost sight of his daughter. He was looking at us. He's like, MashaAllah, please help her, MashaAllah. And he's barely speaking. Alhamdulillah, please, please, please. Please, Habibi, please, Habibi. And I thought, I did not know. I'm looking at him. If you look at his legs, he wasn't even bleeding. The body is such a shock that he's missing all his limbs down here. He's not even bleeding. But he's focused on his children and thanking God for the life he is there to see his daughter. And she passed away. We couldn't do much. And it was that father, I'm not a father, but a brother to a brother. Like, it's over. I looked at him, he looked at me, he realized what I was trying to say to him. And there was no words needed. It's the most painful thing to look at a father and a mother and say, it's over. Your daughter is dead. I don't know how anyone can live with that. Next, please. 6 slides, pretty graphic, but important.
شباب يا شباب حماد حماد
Next. I want to talk about this little girl. Was my first patient. Her name was Hadil. I thought that having to hold the brains of a child, one is too many in Gaza. I thought this was my first one. I was holding her brains in my hands. I thought one was too many. But after her, there's many others that I held personally in my arms after being shot by Israelis. Hadil, we're trying hard, really hard to save her life for about half an hour. Do everything we can. At some point, I looked to my right, I saw a little piece of skull and a piece of brain. And I thought, do I put that back in? I don't know. But just leave it there. It's going to be difficult, but yes. But this is the thing that happened to Hadil. Hadil started breathing really heavy. You can hear that death rattle. If you're in healthcare, you hear it from a mile away. You just know it's the day. I'm like, okay. I say, Hadil, please don't do that. Don't give me that breath. Please don't do it. please, Ya Allah, Ya Rabbi, please, please, I'm praying. And this Dr. Mimi is trying to start a chest tube, and because she had a lot of internal bleeding. And I look, and then she opened her eyes, looked up, our eyes met, she's barely looking, and she looked up. And it was like a look to say thank you. And then she closed her eyes, and that was it. I always told her, I'm sorry, Hadil. We tried hard. But I'm also sorry I paid for your bombs. You didn't have, your look was saying thank you, but please do not thank me because I paid for your bombs. I picked up a lot of shifts before I left for Gaza, and I know that means that I paid a lot more money to kill you. And I asked her to forgive me and forgive us, the American people. We need to ask for forgiveness to Hadil. Whatever you are, Hadil, Habibi, I'm sorry. Forgive us. Next, please. This is a sole survivor. Okay, go ahead. He is the only survivor. He is a burn patient, a lot of burn patients. The good thing is that we're trying to bring him to Nebraska to St. E's Hospital burn unit through Hill Palestine. Inshallah, that works out. But yes. Okay, next video, please.
Exposed brain matter.
It's a brain.
Nothing they can do. So we're putting a guy like this. There's crying. 1 year old. He's having some major.
She's trying to breathe hard.
So he had more trauma. So they put this child on the ground.
That's her.
And let her die on the floor without her. This becomes so normal. So everybody's working on other patients, as needed, of course. This child is sitting here, vomiting, bleeding, open skull fracture, brain matter exposed, flies flying all over him. Put on the floor, put back on the bed, dying a slow death with no family.
I was working with another patient, and that's my brother, Dr. Ayaz. He was videoing that. We're not mean to put her on the ground, but because there was another strike, we needed the bed. She had passed. No pain medication, no nothing. I looked to her, I looked to the back, I saw her on the ground. I said, oh Lord, God, please help us. Please forgive us, because this is not right. It's not that we're disrespecting her, but it's like the triage thing, that you know she's not gonna make it. There could be another patient that will make it. Maybe we can help that other patient. So we put her down because her injuries was so severe that you can see the big brain matter. And Dr. Ayaz finally said, there's a bed that's open. Please put her back. Please put her back. It's horrible to watch her on the ground, but it's really. I will always remember her. As you can tell, she's fighting hard trying to breathe, but she couldn't. Next, please. So, this one here, this guy, this little man here, is another one got shot from here to here, and there was a bullet lodged into the brain. It was bleeding heavily there. We were able to stop the bleed, but if you look at the next picture on the ground, on the bottom here, we were run out of gauze, and so we couldn't stop the bleed anymore. And he lived in the ICU for about 4 or 5 days, I think, and couldn't make it. It was too much. There was no blood either. He needed blood transfusion every day. Next. This is Kamal Adwan Malnutrition Center that has been sieged the last 21 days. Look at these babies.
You are the third person who asked the same thing.
Well, that time he told me.
He told for 3 people. I think in the evening there is one who is coming.
I saw children who couldn't even cry because they're hungry.
I don't know.
They didn't have energy to cry. There's no food. Next, please. Look at how this kid is doing. He's just sitting there aimlessly, just looking around him. There's nothing. The reason I took a video of this child is because we were coming from the north going back to the south, from Indonesian hospital to Nasser hospital. So we waited there for about 2 hours to be allowed again to cross the active military zone from the Israelis. Now, I remember my father, when I was a little boy, my father always was gone. He worked out of town. He was always gone. So every day I knew that he would come back to the village in Tanzania. I grew up in Tanzania. He'll come back home at the end of the month on a Thursday. So I always looked at the little pathway going up the mountain. I always knew my Baba is coming home. So I would just sit by the side of the road, playing with rocks and waiting for Baba. He reminded me of him. But the only difference, I saw the child within me. But the only difference is that he was surrounded by death. Everything around him was death. I couldn't catch the sound, but you could hear bombs around him. It's very close to Rafah. And I thought, I have plenty of room in my house. I live alone. Can I just take you? You remind me of me as a 10-year-old. But here you are, sitting on the side of the road with nothing, surrounded by death and destruction. That could be me. That could be you. That could be your son. That could be your child. That could be my child. But he's there surrounded by death. The young Willy was there. But except that I was waiting for my father because I knew he was going to bring me pop. Only one time in a month that I could drink pop. But he didn't even have pop. He didn't have food, no water. He's just sitting there playing with his stick a little bit while he can listen bombs. I went and talked to him. I said, these bombs. He's like, oh, they're too far. I'm like, how far you think? Oh, 2 kilometers. We have conditioned children in Gaza. The 2 kilometers of bombs is too far. Think about that. 2 kilometers is far. How is that possible? We have lost our humanity. Not the folks in here, I look at you, I feel like the same way I felt like I was with my brothers and sisters in Gaza. with the same goals, same values. But some of us out there have lost that contact with our own humanity. Next, please. This is very hard for me to talk about. This is Dr. Muhammad, the brother that reminds me of my brother Saber here. He took me under his wing because every time there was a break, usually there is no break, but in between Israeli strikes, I would go help in the ICU from the ER. He lived in Jabalia. 2 days ago, before I got here, Indonesian hospital got destroyed. All the patients left. So he went to help at Kamal Adwan, was under siege too. He got shot by a sniper, Israeli sniper. He invited me to his house. These are his daughters. Beautiful. The one he's holding, her name is Yemen. He named all his children after freedom fighters and the countries that fight for freedom. Her name is Yemen. Beautiful. Little girl. But I promise him, for as long as I live, his kids will go to school and will take her home. I swear. And one of them, the little one over there, is Jaffa, a city in Palestine. What was the other city? Haifa. In Haifa, yes, those are the names of his children. I will forever miss my brother. He's the one that said my wife, he took the 6 eggs he got from the UN. He took, his wife made us shakshuka, and he brought it to us. Please play the video. This is his home. That's Hebrew.
From the army, deep in your home. Yeah.
They made his home. Play the next video too. The next video tells you that they made his home prior to this current siege. They made his home. Israeli soldiers came in. They made his home command center. They have a list of duties and however many combat. That is his wife opening that destroyed area of his house in Jabalia.
And they destroyed it, and then they made your home to be their command center.
So, but before they left, they destroyed everything around it. Destroyed the house, the kitchen where they were cooking at, and everything. But now, I was like, brother, I'm so happy you survived. But I spoke too early. No. Next, please. Now, what are we going to do from here? This is my last slide. There's a lot we can do as Americans. Please follow Nebraskans for Palestine on Instagram. We will follow you. Anti-war committee in Nebraska, in Omaha, in Minneapolis. Together we can change the face of this earth. We can stop this barbarism, this war machine that we have in our country. Donate funds, items to organizations like Heal Palestine. Heal Palestine I've worked with. I've gathered children and their names while I was in Gaza that we're trying to evacuate here. We've done a lot of that. Heal Palestine has brought a lot of children from Gaza. Volunteer. Another thing I want to tell you this. Israel wants this from you, to desensitize you. You've seen so many horrors that you become desensitized to seeing horrors. So therefore, you're like, oh, another child killed. Volunteer. Don't be desensitized. Reach into your heart. Remember when this began? We will cry, 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 cry. I think Israel wants us to get used to it so that we back off from protesting, from participating in our organizations. We cannot afford to do that. Our Palestinian brothers and sisters and children are counting on us. I'm asking you, get fired up. talk about it, invite your neighbors, come to protest, do it for our sake, for the sake of the children in Palestine. We cannot sit down. I told them, as long as God gives me breath, I'll keep speaking. And I know Israeli will want to take me out because I get their threats online. That's fine. But as long as I'm alive, we're going to do it. Because that's what humanity is about. Raise funds for medical equipment. In Gaza, there was no gauze, no sutures, no sterile. I saw from an IV catheter where a patient is receiving, it's a central line, it's a bigger IV, pus coming out of it because it's not covered. So infection gets in easily. So you squeeze, I squeeze out, it's pus, yellow pus coming out. And they're gonna get an infection. So, and host a family. If you get together as a Minneapolis organization, we can talk to Heal Palestine. If you're ready, we can host a Palestinian child, and usually with one caretaker, you can host them. And as long as you can collaborate with a local hospital, you can start a Heal Palestine community here. It's called Healing Community for Heal Palestine, and then you can be able to host a family or two families. You're a big community, you can afford it. As long as you can have people volunteer to take the kid to appointments, things like that, doctor's appointment. Yes? Yes.
So if you guys could follow Healthcare Workers for Palestine Twin Cities account on Instagram, we are starting this initiative, and I'm so appreciative
Awesome.
you brought it up today.
Yes.
Another thing is, at some point I wanted to mention that because there's also lots of censorships with hospital systems here, later if anyone can find it, there's a petition to bring that about as well. Because it's also limiting a lot of us being able to connect hospitals here to bring kids from Gaza.
Mm-hmm.
Is the fact that there's some hospitals preventing us from saying Palestine in the hallways of our hospital systems, and there's been pro-Palestine health education lectures that have been shut down completely by certain hospitals here.
Mm-hmm.
So if anyone wants to find me afterwards.
Yes, it's very critical because if you say Palestine in any healthcare system, you can be fired. There's a New York nurse who was given honors a week prior about being the best healthcare provider and the best nurse. She got a Tulip Award. That's the highest award you can get as a nurse. She got it. But then she said something to a coworker about Palestine. She got fired. They told her, why am I fired? She said, they told her because you do not represent our values. But the question is this, what more values do you need besides taking care of a patient? It's just because I spoke about Gaza. They said we cannot talk about Gaza here. They fired her.
I just want to give a gentle reminder to give Mr. Massay his time to speak, and then we will have a question and answer time. So rest assured we will get to your questions.
Thank you. And so actually I'm going to end up here. Thanks, brother. I'll give time for questions, but thank you for listening. I appreciate you all.
So, thank you all so much. Thank you. Wait, everyone, hold on. We are having a donation pile, boxes go around. Every little bit counts. We'd really appreciate your contribution to this incredibly important cause. I think it is often said that, the money that we donate saves lives, and I think that we can say this literally, that the money that you donate here today will be a part of saving lives.
All the money from today will go to Heal Palestine. If people wanted to donate online, that's fine too, but that's where the money is going.
And a reminder that Mr. Massay is here from the Nebraskans for Palestine, and so if you are on social media, I would encourage you to follow Nebraskans for Palestine to stay up to date on Nebraskans for Palestine. Instagram, I believe, yes. We are now in the question and answer portion of this. Are there any questions here from the audience? I see a question from the gentleman over there. We'll get you a microphone.
Hello?
Just speak very closely to the microphone.
Put it right by you. So, wanted to, well, of course, there are no words to what we've been testimony given. Our tears are with you. I wanted to add to somebody from healthcare workers pointed out. I'm working with a university with a group of doctors, and we have a group called Doctors for Humanity. And together with Healthcare Workers for Palestine, we are working with Heal Palestine, with Steve Saucy there, and you probably know them. And it's not as easy, you know. You would think it would be easy, but not. We find resistance from hospital to take on responsibility to bring some of these children. We right now have 2 children that are waiting to come. One with a head injury needs a cranioplasty. I'm a doctor at the university. I'm a neurologist, and we are working to bring the 3 children, but we cannot find hospital. So if any of you connects with Gillette, Shriners, Children's Hospital, or the burn unit in St. Paul, there's one at Hennepin too. Please see me. I have some information. We need help. We're doing this with healthcare workers, but we need help. You know, we can help on this side, and you know, we have to. We cannot abandon these children. So anybody who wants to cooperate with this, with Heal Palestine, and connect with us, we are just about ready to bring some of those kids over, but we need some help, especially from those hospitals. So please see me. I'll be around. I'll give you some more information. So thank you very much.
So moving forward, I just want to clarify. I would like strictly questions. So you know, if you have a question that ends in a question mark, I would greatly appreciate that. For Mr. Massay's time, you know, coming all the way here. I see a question right here.
Where?
Lena.
Is it on? So you stated earlier that as a medic working in Gaza, you've become kind of a journalist to spread the word of what's happening in there. Can you speak to some of the headway you and your colleagues have been able to make about educating people and getting things published, if you've been able to persuade people that you've run into by sharing your stories?
Yes, very good question. You know, like, you know, the international press people will not go into Gaza. So we become basically everything to bring the information out. We tried. One of the articles we wrote is 65 doctors and nurses in the United States wrote to the New York Times. I think I have that link up here. If not, I will post it on my Instagram. I think it's Wilberforce or Wilberpeace. You can share it. But please write that. Read the article. You will see everything I've talked about from healthcare providers and nurses who have been to Gaza. And write to the New York Times. We did not believe. My friend Dr. Feroz, who was the main guy that wrote, he's a surgeon. We couldn't believe that. He said, guys, I can't believe they're going to publish it. It took us about 3 weeks to try to have them publish it. Now, what happened is that the New York Times has been receiving death threats too, because how dare they publish anything Palestinian? How can they do it? One of the doctors, that Dr. Mimi, that's been getting death threats, she's the one that shared an X-ray image of a bullet in the brain of a child. She's the one that's been getting a death threat. So we've been trying, and we also wrote about the same number of doctors and nurses wrote to the president, sharing with him that this is an abomination. This is crime against humanity. And a couple of days ago, 117 doctors from Israel that have humanity in them and nurses wrote to the White House says we support our colleagues. When we say never again is never again is now for everyone, we support our colleagues in the United States. These are 117 Israeli and Palestinian doctors. Palestinian doctors and nurses in occupied Palestine did not want to put their names, but they signed it because it will be a huge repercussion if they do. So yes, we try to reach out. We try to talk. I've talked to a lot of radio stations, a lot of TVs. So anywhere we get our word out, we need to talk to. So we're trying. We tried, and it's working. Inshallah.
Did you see any aid organizations successfully bring in medical supplies or food or water into occupied areas, and what did they do differently to actually get their supplies past IDF forces?
Thank you. Very good question. So since we wrote that article in the New York Times, and Israeli learned that we are sharing information with the world, and these are nurses and doctors that they allowed to go in. Now remember, at some point they only allowed 72 nurses and doctors to go into Gaza, right? That is 1 in 33,000 people. One provides about 33,000 patients in Gaza. Now, the number has gone down since then, only because they stopped 6 organizations, 6 of our international organizations from going to Gaza because of the article we wrote in the New York Times. So we are getting punished. Israel 2 weeks ago said, no more. Any organization that has an Arab doctor who is the head or is a medical director of that organization, they got canceled. Rahma is one of them, PAMA, Palestinian American Medical Association, and there's a couple of other ones I forgot. There's about 6 of them got banned. So it's hard to get in things. But hopefully, after this is over, maybe we'll be able to, maybe they will reverse. Kogat, which is the organization within the Israeli government that allows, that allows or does not allow things to go into Gaza and Palestine in general, banned us. But hopefully they will let us in again. So it's very difficult. Hill Palestine is in the north. I have worked with Hill Palestine up in the north. They are on the ground, they have people on the ground, but in the last 3 weeks since the last siege of North Gaza, nobody's going up north. So inshallah we'll be able to go. But it's a difficult situation right
now. I just want to thank you deeply for all the things that you have shared, and while it's difficult and traumatic for us to see, I know that speaking of them over and over again must be also difficult, and so thank you for putting forth what's necessary. My question was, and I know that your primary work was trauma, but how is the sort of general health situation on the ground, like nutrition and communicable disease, impacting both things like trauma and also death? I feel like the genocide wants to both destroy Palestinian people with trauma, and also the slow deaths of malnutrition and disease. But I was wondering what your perspective and what you saw.
That's a really amazing question, because as I said earlier that, it's very difficult to talk about it, but I promised my Palestinian brothers and sisters and children in Gaza, I'll speak. I was talking to my other friends, the doctors that went with me. None of us can sleep. You feel guilty eating. I've really eaten really well because of Sabr here in Minneapolis, but otherwise I cannot eat. I cannot sleep. A couple of nights I dreamt I was being chased, but I was arrested by Israeli forces, and they shot everybody else in the head, but when they come to my turn, they told me that they will chop my legs and my hands, and I woke up sweating, and I thought, was like, oh, my legs are there, huh? Okay, thank God they're there. But I couldn't feel my, when I was driving the next morning, my legs are shaking. I'm like, well, but I'll survive, you know. I'll be okay because those children in Gaza are living with it. So who am I to complain? I don't even want to shower. I mean, sorry, I showered, but still, I tell you, because running water, there's no water in Gaza. You take a lot of toilet the wipes, but they took some of our wipes away because they thought there's too many. I had 8. There's too many of them. I'm like, really? How do you? Okay. But it's okay. They can keep them. Maybe you need some. So back to your question, yes, there is a lot of other communicable diseases. What we saw too that came to our emergency room was a lot of patients that were really, really sick, hungry, malnutritioned children. They cannot even cry. Diarrhea, from drinking contaminated water was huge. A lot of children came in, cannot even do anything anymore because they're extremely dehydrated, malnutrition, and they have had diarrhea and vomiting for days because they don't have transport. By the time they get to the hospital, it's too late. Patients with cardiac heart disease, sometimes a lot of them, some of these patients that I saw you, if we had a neurologist, for example, on board that had brain gunshot in the head, maybe they had a chance to survive. But one of the children there that was shot in the head, maybe we could have, the doctor said maybe we could have saved him, but we don't have a neurologist, nobody. Another thing is that there was only one CT scan in the whole of Gaza. It's in the Nasser hospital. In north, at the Indonesian hospital, Israeli forces, when they were there in March, April, somewhere there, and June, up to June, they had burned down EKG machines that looked at your heart. They burned down X-ray machines, MRI machines, and a CT scan. Burn it down. Even printers. They burned printers. So yes, there's a lot of situations, a lot of diseases that are happening that we needed a patient. We didn't even have equipment to test a patient for sepsis. The labs cannot have equipment to test a patient to see what they're suffering from. So yes, a lot of communicable diseases are happening. Diarrhea is one of them. Polio. When we were there, the cases of polio, but now the polio vaccination has stopped because Israel wants to annihilate Gaza. So why give polio vaccine when they're killing?
I would like to use this opportunity to ask a question myself.
Yes, sir.
So you mentioned that you went to the ICC, that you were in conversation with them. Now I think one of the big things that a lot of people are talking about in the media is this a genocide? Does what is happening in Gaza constitute genocide? And I wanted to ask, do you believe, as somebody who has been there on the ground, that what we are seeing is genocide, is the intentional slaughter of these people, and can you tell us more about, what you saw and its connection to genocide?
Thank you. Very good question. I don't know if I should have mentioned the ICC, ICJ, because I'm sure Israeli, if they're probably listening on my phone, they put that bug in there. But it's okay. Yes, the South African government had reached out to a lot of us, but a lot of people don't want to talk about it because they're afraid they may not go back to Gaza. But some of us talked anyway. But we shared some of those human crimes against humanity videos and pictures. Yes, it's a genocide because why would someone shoot a child in the head? Why would somebody shoot a child in the chest or in the neck? One of the pictures I show, there's a gentleman that was shot in the back while he's fleeing away. His grandson was killed. It was only the grandson was only 14 years old, but he was shot in the head, in the back, and this was an exit wound. When you are shooting somebody from the back, they are not a threat to you. They are walking away. Why shoot him? And they also shot him in the knees from the back. His knees were completely shattered. It's a war crime. It's a genocide. Another example of a genocide is a slow death of communicable diseases, right? Another example is to stop the food, water, shelter. We didn't have water. Israeli forces took water filters that we were going to give and donate to the people in Gaza. They took water filters away from us. They didn't even want me to take my own filter for water. It's a lot of examples, a lot of gunshot wounds to the femoral artery. What does that mean? Completely dismantle this patient, this person, and they killed. So, good question. Thanks, brother.
I see one question back there.
You're back. Are you sure? All right. Thank you, brother. From the bottom of my heart, thank you. You touched me on so many levels. I'm a burn and trauma ICU nurse. I worked burn and trauma for 20 years. I'm a member of Healthcare Workers for Palestine. I have to make this legal disclaimer before I say anything else. I do not speak on behalf of myself. I do not speak on behalf of any union, organization, or committee. I speak only on behalf of myself and anybody else who agrees with me, and people who are silenced and marginalized especially. So here's my question for you, a very simple, very direct question. Is it true to say right now at this stage of the game that approximately 95% of all elected officials are complicit in this genocide, either by active support or participation, or by their complicity of silence? Yes or no? Thank you.
Yes, of course, because there is no way around it. Yes, 100%. You cannot speak on to. You cannot say we want a ceasefire and yet you're providing weapons. You cannot say a ceasefire. You cannot say a ceasefire while you are starving the people in Gaza. I saw this stupid pier from Biden when we were going to the north. The remnants of it, because it only lasted 2 weeks for $300 million. We should be asking where the money is. Who took the contract, right? That stupid pier is there. It was kind of remnants of it. It looked silly. And for the U.S. military to say that that we couldn't keep it there because of the bad weather, these engineers, you don't know how to make a pier that with waves. It's not even a tsunami. What are you talking about? So yes, it's.
Thank you so much for giving this talk and for going there. I really appreciate it, and I know that you work with individual patients, and your focus is on the benefit of an individual patient. But I'd like to know how you feel philosophically about taking children out of Gaza, knowing that they probably will never go back.
Good question. That it's a very moral and a theological question, because they may never go back, but maybe we can save them here in the U.S. or around the world, and someday maybe when Palestine is free, they will go back. They'll go back to Gaza. Most Palestinians don't want to leave Gaza. They said, I want out. This is my land. This is my home. This is where, this is. But guess what? A lot of them give back to the community that I know. So, and this is the most difficult thing for me as an American coming here, American Tanzanian coming here. One of the sisters asked me what was the most difficult thing for me coming from Gaza. Is once we were about to leave Gaza, I look around are those children that we every time after in between Israeli strikes, I will go out there and to the tents and play with them, give them chocolate. They will play soccer. They came, a lot of the kids came and to say goodbye. I wanted to take them with me. But at the same time, they're like, no, this is my home. This is my home. I will die here. I will die in my soil. They don't care about what the colonizer wants. It's like, this is my land. I'll be buried here. So my humanity, my side of me says, I want to take them here. I want to take them with me, but at the same time, I do know one thing for sure is this, that I may never ever see them again. I'm going home. That was the most heart-wrenching experience. I'm going home to the safety of my own house, knowing that these beautiful children, I may never see them again. They may be killed. Some of them probably killed, for sure. It's not maybe, they probably are. To know that this is my final goodbye. Why was I born in Tanzania and became an American? But they're born in Gaza. They're being annihilated. What's so special about me? I'm going home. Grown man, I cried all the way to Amman. All of us did. Thank you.
This is what's so special about you, that you're coming back here to talk to us. Yes.
Thank you.
Hello. I want to personally thank you for sharing your experience with us. But another question that on too many people's minds, from your experience being on the ground or having the privilege of being on the ground in Gaza, and being part of a charitable organization, what is your impression? Do you think that we could replace an organization like UNRWA? I mean, is that possible to fulfill that shoe with other organizations? Or what does people share with you in Gaza? Because we know that UNRWA is very critical for Palestinians. Most of Gaza residents are refugees. Can we replace this organization, or is it very crucial?
Good question, brother. This is the thing that Israeli wants the world to believe. Another method of annihilating a people is to dismantle the social services. One of them is UNRWA, right? UNRWA is a Palestinian organization that helps both people in the diaspora and in Palestine. They want to demonize UNRWA because UNRWA is a lifeline for Palestinians. So once UNRWA is gone, there will be no life, no food, no education. Gaza is the most educated place on earth. 98.2% of Gazans are educated, extremely educated. 94% of West Bank is educated, more than anywhere in the world. So if we dismantle UNRWA, UNRWA is very good in providing education and schooling for kids in Gaza. So if UNRWA is gone, there will be no doctors, no nurses, no engineers, no lawyers, no anybody in Gaza that's left. Because they're already killing educators, they're killing press, they're killing doctors and nurses. And guess what? Ethnic cleansing at its best, right? So we cannot afford to replace any Palestinian organization that helps the refugees. What we can do is, as a people, expand UNRWA, give money to UNRWA, call on to the American government, say it is against it. They are giving Israeli military. We're giving Israeli military to almost $40 billion now in weapons and bombs, but we just cut off lifeline for money to go help the people of Palestine. That just boggles your mind, right? We're giving money But yet, for bombs, but we're going to cut the refugee funds. What are we as a people? We need to force Tim, Kamala, Biden, and all your representatives that reinstate the funding for UNRWA. Because UNRWA, I have seen UNRWA, they have schools, they have right next to Indonesian hospital, next to Nasser hospital, is an UNRWA school. You cut off UNRWA, there's no lifeline. Other organizations like Heal Palestine, like Rahma, like PAMA, or UK Med, we all need to come together to expand our humanitarian reach. It's about 200, they said that 350 years it will take us to rebuild Gaza. Yeah, but yeah, they're trying to. But you know what though? Even in the middle of the destruction, I've seen a lot of buildings destroyed. Everything is rubble. People have painted. Gazans have painted. Don't cry, Gaza. We will rebuild. And just so you know, about so far we say 42,000. According to Lancet, a well-recognized magazine and a new scientific paper, 186,000 Palestinians have been killed. And this is since July. It's probably different. Thank you.
Good afternoon, and thank you very much for being another one of the brave truth tellers. Thank you. So I noticed in the very beginning that theological studies is also a part of your path. So as a person of faith, I'm curious to hear how it is that you're navigating this time and how your beliefs are part of your motivation for what you're doing. And again, thank you, thank you, thank you.
Thank you. I appreciate you. I don't deserve the thanks, but thank you. I appreciate you. I was before I'm a new convert to Islam, but before that I studied to be a Catholic priest. So I studied philosophy and theology. Once I left that, because I thought God was not calling me to the life of priesthood. You know, I think I can serve humanity in other ways, right? So when I left, I taught high school for a few years, theology. So I taught Hebrew scripture. I taught the whole Old Testament. And I taught Pauline letters in the New Testament, the Gospels, and Christian morality and Christian philosophy. And also I created a class in my own in the school system, Holocaust and morality. So we talked about Holocaust, that we talked about never again. Sometimes my former students on social media, on Instagram, they send me, Mr. Massay, you said never again, but it's happening in Gaza right now. I was like, yes, that's why I want you guys to speak up. So my faith of saying never again, because we had talked about the Holocaust, we've talked about the genocide in Cambodia, genocide in Rwanda, and another place in Congo. We talked about that in my class. We watched a lot of movies, Schindler's List. We watched a lot of, we read Anne Frank. We read that book. Elie Wiesel's Night Trilogy. We read all of those books. And my students today are asking, what is it that has gone wrong in our humanity? We talked in class, we discussed this every single day, but our government is still killing the people in Palestine. In Israel, the people that have survived the Holocaust are the ones that are doing another Holocaust to another people. What has gone wrong? Do I have an answer to that, to those students, my former students? No. So yes, my faith keeps me going. If I don't pray, I think I'll be a dead man walking. I feel sometimes I am already, but.
Hi, can you hear me? Okay. One thing that I've been wondering, this is a little bit out of your the scope of your work maybe, but not outside the scope of the genocide. In Lebanon, they had pager attacks a couple of weeks ago, and I heard that was it like very much affected like the healthcare system in Lebanon. And I was wondering, as someone within that field, if you could kind of elaborate on why that can affect the healthcare system so broadly and so deeply.
Yes, very good. Thank you. So Israel has used a weapon, an equipment for communication as a weapon. If that's not terrorism, what terrorism is? What else can they put in our phones if they want to, right? But yet they couldn't allow us to go in with ultrasound into Gaza. The whole thing doesn't make sense. Of course, it's a genocide. Now, another thing is this. No one has a monopoly to say this is a genocide and this is terrorism and this is not terrorism. We say, oh, these people are terrorists, but yet nation state can be terrorists. Israel is a terrorist state because of what they have done, right? And using those equipment to terrorize people is horrific. I was supposed to go into, I was about to cancel the coming to this event because trying to go to Lebanon 2 weeks ago. I was going to go with my friend, Dr. Bing, that is there now, to go and set up field hospitals. But then the UN said that they don't have logistics yet, so we'll wait for some of us to go. So what is happening in Lebanon is another genocide, another form of terrorism. Because when Dr. Bing was there, she landed in Lebanon. She thought, because the airport we were supposed to get there too, but she said there was a smell, a stingy smell. And one of the doctors there, Dr. Marwa, she says, because Israel yesterday, they just used depleted uranium to bomb part of the airport. Now tell me, that is not allowed in international law. So if you see Netanyahu with this stupid map about the greater Israel, including part of Syria, Lebanon, and Jordan, and part of Saudi Arabia, if you are native to the land, why will you bomb the land using uranium, knowing that it's going to be destroyed forever? So that means if I'm a native to the land, I'm going to protect my land. I'm going to keep it for future generations. You know they don't care about the land. It's just expansionism, settler colonialism, so that they become our little puppet in the Middle East. So.
Thank you. Yes. So we'll have Sabri has something and we'll have some closing remarks from Liz.
So.
Questions over?
Yeah. One more. Wait. There's one more question. One more question. It's up to you.
Okay. Yeah, one more question.
Thank you very much. I know it's very hard for you to speak to institutions like journalism or things because of the threat. Have you been, or these medical organizations that are working humanitarian, approached by human rights organizations like Amnesty International and others for investigation, or the ongoing investigation to make the case against the Netanyahu government for war crimes against humanity? Can you elaborate on that, please?
Yes, because the journalists cannot go into Gaza, right? Nobody can go. So they only depend on healthcare workers, and that you can provide whatever you can. Before we went, I don't know, somehow they found out who is going and who is not going. And very few people have gone into Gaza. In the US, only 65 nurses and doctors have gone so far since October, right? But somehow, I think it's a very small group. So they will reach out to you and say, please document any war crime you see. So yes, some humanitarian organizations they have reached out to us to provide what we have seen. And someday, hopefully, inshallah, that the world will see what we saw, and history will decide. And I know history will say this was a genocide and ethnic cleansing because of what we have shared, and I think, yeah.
So we'll have one final question over there.
Thank you. Assalamu alaikum. I'm not a clinician. I'm in public health, infectious diseases, and Israel bombed all of the places that they keep records. Doing research, I'm having a really hard time getting data on any kind of exacerbating diseases over there. Do you know any sources, anyone we can follow? Are you documenting what conditions you're seeing quite often and where we can access that? Maybe even calling and emailing them directly to figure that out?
Yes, very good question. We do need a lot of healthcare, public health to go in there. Your work is going to be extensive. I don't even know where you're going to start in Gaza because it's the destruction, what has happened, the spread of diseases. We need, part of the public health is disaster management and relief. You should be there to help, but you cannot go because you were not allowed by Israel. Yes, reach out to organizations like Rahma. Rahma has well documented information about, it's RAHMA. Heal Palestine has a lot of that. PAMA, and UK Med as well. So UK Med now is mostly doing ER. Doctors Without Borders is doing pediatric inpatient. So because we learned this, the organization learned this. When Israel knows that this particular part of the hospital is only run by Palestinians, they're going to bomb it. But if we say UK Med is running the ER, they're going to try to be shy a little bit. They'll still bomb it. They don't care. But they're a little shy in bombing. So UK Med is mostly an ER, so they run the ERs in Gaza. Rahma runs mostly the ICUs, critical care, so they have a lot of information about that. Heal Palestine is mostly on the ground with distributing food, water, shelter. They have a little, outpatient hospital at, in South Gaza, so they will have all of that information for public health workers. We know one of our sisters in Gaza, in Nebraskans for Palestine, Farah, she runs our website. She's a public health. She runs the Nebraskans for Palestine Instagram page. She's a public health, and she needs, maybe you two can connect and go to Gaza together, because your work is cut out. And mental health workers. I don't even know. We can fix bones and other diseases. For the brain, I have no idea how you guys are going to, but I have faith in you all. Please go. Whenever this is over, please go. The trauma of those patients, those kids, I don't know. May Allah forgive, help them all.
Can we take a moment first to thank Willy again for coming from Omaha? And Willy is planning on returning to Gaza in 6 weeks, and our hope is that he will be able to take all of our love and solidarity with him.
Thank you, guys. I appreciate you, folks. I have no words. All I'm asking you is continue fighting, join your local organizations, show up. The more we are, that's the more power we're gonna have. Yes, power is in the people, and you have the power. Minneapolis had shown the world when. Another thing I want to tell you this: in Gaza, there's George Floyd murals all over. Remember, Palestinians had set up an account during the George Floyd protest, a Twitter account, and I think on Instagram, teaching Americans what to do when the police fire tear gas on you. Always bring milk, water. They have that. They were teaching us what to do because they know. The same tactics the police used here, they were being used on them. Our police learned in Israel. And I was in Hebron before the war, since 2018. I was 2016, I think, my first trip, but in Palestine. There was There's the Black liberation movement in the U.S. is similar to the Palestinian liberation movement. Very, very similar. And for my white brothers and sisters, you and us who are fighting with us, you are also the lifeline of freedom fighters. You are walking in the feet of the freedom fighters of this country. And for the black folks, for the people of brown and black folks in this group and anywhere around the world, Nelson Mandela said, our freedom is incomplete without the freedom of the Palestinian people. Archbishop Desmond Tutu of South Africa, may he rest in peace, said once he was in Palestine, one time he said, he thought the apartheid in South Africa was worse. But he said, what I've seen in Palestine is worse because they are continuously annihilated and being bombed by Israel. That's what Desmond Tutu said. And also, I want to end up with this. And I end up with this statement. This is a very African philosophy of life. It's called the Ubuntu philosophy. Ubuntu philosophy means, it says this: I am because you are. And because you are, so we are. Remember the Ubuntu philosophy of life in African culture. I am because you are. And because you are, so we are. Because of Palestine, it is what it is because of us. And we are because of Palestine. Always walk with that. Thank you so much, and God bless you.
So, my brother Willie, so kindness and gracious, could you raise your hand if you were horrified by what you heard and what you saw? So now let it sink in what I'm about to tell you. This brother graciously kept complimenting me. Let me compliment you about just what kind of true hero. You are a hero, Willie. You are a hero. Yesterday after the student protest, he was with me in the student protest. We went out to a restaurant. My daughter and her husband and me and Willie. He gets a text message while we're at the restaurant. And he's happy. He's giddy, like the same look a child gets when you give them candy. I quickly ask him, Willie, what's up? You are horrified what you just heard and what you just saw. He was giddy because he just got the incoming message from his team of healthcare workers, the team that he's part of, telling him you've just been approved, you're going back to Gaza in less than 6 weeks, and his response was being happy. Stand up and give this man a standing applause, please. That is the definition. This is what a hero looks like. Not celebrities that are scared to tweet. Celebrities that are scared to send a tweet to say no to genocide. This is what a role model. This is what a hero looks like. This is what...
From the river to the sea, Palestine will be free. Woo!
You heard what he said, guys. He was giddy, knowing he's going back to what we saw. So don't let anyone tell you that our protests, that our events do not make a difference. You heard what he said. You heard what the people, the children of Gaza told them, is to tell their stories, and that we need to keep fighting. We need to keep taking the streets. We need to come to the events. So please, everyone, pass on what you saw today to those that aren't here. I'm pretty sure every one of us has family and friends that couldn't make it today, but would love to hear what went on today. Thank you, every single one of you that came out today. And could we please thank the Anti-War Committee, the MCs, for the great job of doing this today. Willie, could you tell them your social media if you have social media?
Oh, if I know, okay, so I'm not really good at this. It's. Do you know which one is that one? Do you know? It's Wilberforce or Wilberforce? Which one is mine?
Nebraska for Palestine.
Mine is Wilbur Peace. WILBARPEACE, like Wilbur Peace. Yes, that's my person. Yes, that's me.
He has a Palestinian flag.
Palestinian flag. It says, I start with Palestine. WILBARPEACE. That's me. Just so you know, it's very dangerous to post anything while in Gaza, because, as I said earlier, healthcare workers and freedom and journalists are the protected group, but not on this war. Israel will kill you. So I turn off everything when I'm there, because if I post anything, I'll be a target. I'm already a target, and we're already a target, because we signed this form that says you will be killed if you go into Gaza. But so only when I make it back to Amman, that's when we post stuff. Inshallah.
Yeah,